Good morning. Good morning. You're welcome to today's lectures on BDT 253, Pharmaceutical Calculations. And in this course, if you want to make it in this course, you need to actually be dedicated. You need to do what? Be dedicated. You may be intelligent and still fail the course. Once you are educated and you are serious-minded and listen to instruction, I don't think you have any issues in this course. And the course is very, very pivotal. You are truly in this as a pharmacy technician, because most of the things you'll be doing throughout your practice, unless you don't want to practice this course, even as a pharmacist, has a lot to do with what? These calculations. And if you hear from pharmaceutical calculation, at least the one you need to be able to dispense medications to patients is not big calculation, big mathematics. It's just basic mathematical principles. Once you know the basic mathematics principle and you are reasoning and you can reason, you can think out of the box, you'll understand the course. Okay, I sent you some. Sorry, my name is Pharmacist Emmanuel Chetanna. I'm also known as Pharmaceutically the School Board. So please, in the group, I sent a lot of things in the group. You've seen it, right? You've seen them, right? Yes. First, I sent all the materials you need for this course. So a smart student by now would have covered up to 2, 3, or 4 of them. Yes. Then, yesterday or so, I sent you revision questions for the first 6 topics. So those revision questions, try as much as possible to solve those revision questions, because the bulk cover of your corporate assessment will come from there. And one thing you should also note is that you should not miss my lecture, because if you miss my lectures, you'll be confused. You may want to go and look it up somewhere, you may not be able to understand anything. So try as much as possible not to miss my lectures. And what you expect from this course is that you have, your exam is 100%, right? So as a total is what? 100%. And your exam is 70%. The main exam is 70%. And your continuous assessment is 30%. And the continuous assessments, were you told anything about the semester exam? Did you write this semester in your first year? Okay, I hear something like that, but if it's something worthwhile, if it will actually hold, depending, but just know that 30% will come from those things I sent you. Each of the topics, there are 11 topics, right? Each of the topics, we have 100 questions there. And you are going to do your continuous assessments on each of these topics. My pattern of continuous assessment is that if I teach for like 1 hour, 30 minutes or so, depending, I'm using maybe 30 minutes, you pick any question from this 100 questions. If you start from the first topic, numbers and numerals, you pick. You'll be given papers you pick from. Any question you pick, I'll call the question for you, solve it on the board before everybody. If you are done, I'll score you. This is how we'll be doing it for all the topics, from the first topic to 11 topics. And after each topic, your scores will be published. You see your scores. So if you are doing well, you know. If you are failing, you know. This is how it will build up for all the 11 topics. So these 30 marks These 13 marks will be generated from this thing I'm talking about now. And if you are having issues with this, just know that you will not take it in the exam. Because the questions here, you will still see them in what? The only difference is that you may change figures. If this place you have 3 or 4, you may see something like 2. So that means if you don't understand what you're doing here, you still have issues here. So you start from the beginning. That's why I sent you the materials ahead of time. So you have no excuse that you didn't have time to do what? To study. So please take this 30% here very, very seriously. Now, if you look at the outline and the materials I sent you, you read that the first 6 topics are just math review. The first 6 topics are just what? Math review. These are mathematics you should know by now. True of us. These are things, if you actually know your way yourself, these are things you should know by now. There's no way you predict mathematics without knowing those things, unless something happened along the way. You know yourself. But the fact there is that I will not waste my time on those numbers and numerals, name them, notation, numeration. You come down to approximation, rounding, all those things. You come down to the fourth one, ratio, proportion, and variation. These things are mathematics, 3 of us, which I believe you should know by now. Then you come down to pharmaceutical measurement. Those things are just units. They are units: milligram, kilogram, male, and what have you, measurements, weight, all those. These things are what you must have done in your physics. 3 of us. Good. So I will not waste my time there. So, but the thing there is that as I'm teaching, if there's something that has to do with, make a reference to them, I may just talk about them, but not to sit down and start talking about it to waste our time. So that's why I sent those things so that you study ahead. You review. These things are called maths review. The main topic we are studying from is the 6th topic, which is what? Is it dosage calculation? Topic 6 is what? Topic 6 is what from the outline. Dosage calculation. That's where we are starting from. Dosage calculation. Pack your hair well before you come in. Pack your hair well. Dosage what? Calculations. Now, from next week, not next week, from Thursday, we will start our CA with numbers and numerals. From Thursday, we will start our CA from what? Numbers and numerals. So what I will do is this. Use this time, try to review those things I sent you. Solve those questions. Solve those what? Questions yourself. Solve them. They are simple. Solve those questions. Out of that 100 questions, I'll just write from 1 to 100. Fold them and keep it for you. If I call you, you pick. Any number you pick, I'll set the question for you on the board. You answer. I'll give you like 3 minutes. You say you are 20 what? 22. Good. So each of you will solve four questions. Four questions. So if I call you, you solve 4 questions. And that 4 questions, I'll just give you 5 minutes to solve the 4 questions on the board. If you are done, once your time elapses, you stop solving. I'll mark it in front of everybody, and you see where you have the error you committed. Am I committed? Then the scores will be recorded for you. This is what you'll be doing every day. I come here, bring out time. If you are done with the first topic, we go to the second topic. This is what we do until the end of this course. Okay? So from the beginning, I don't know what is. Let me wait till the exam time before you don't exist in my course. You must start from the beginning and start reading. So if there are times that believe that you don't want to read this course, let me wait for the exam. You can never pass. It's not possible. Go and ask the older sets, the set above you. Ask them, they'll tell you better. So you must be disciplined. You must discipline yourself to sit down and do what? Study. You must do what? Study. Now, second, another thing that I record my lectures, whatever I'm discussing within the class, I record my lectures. I post it on my YouTube channel. If you watch, I'll be posting some links there. Good. Everything I say here, anybody in the world is free to say that what I'm saying is not what? True. So you yourself, you feel free to record my lectures if you want. I allow that. It's for your own good. You come in. So feel free to do what? Record it if that will help you to understand the course. Feel free. Okay? Now, so as I say, we'll start from dosage calculation. But doing our revision, maybe after, if I call it any person to do the month review, if there's anything, I will use the opportunity to solve the question, do the correction. So if I were you, once I call somebody here to write, try to put down, of course you already have the questions anyway. Just try, as I'm doing the correction, try to do what? Know the corrections, okay? Because you won't even know the question you will give. This is what will make up our CA. If there is anything like mid-semester exam, it will still come from there. You have made an exam, it will still come from there. I source questions from no other. Ask them. I'll give you my questions. Go and do what? Solve. If you are waiting for one question to come from me, it's not true. The question will still come from where? The same place. So anybody that want to fail my course, we fail and blame and beat his chest and say mea culpa. You know what's mea culpa? Mea maxima culpa. Oh, nami foko. Nami. So the point there is that whatever you need, you have it. You have it. The only difference is that some figures may be changed. That means if you truly understood what you read, you can still do what? Solve it. So in the course of this exam, this course, you have up to 1,100 questions at your disposal. Each topic is 100 questions. Each topic is 100 questions. 100 questions times 11 is what? 1,100 questions at your disposal. If you want to pass, you pass. If you don't want to pass, you do what? You fail. So if you have everything at your disposal, why won't you score A if you study? If you want, there's no answer there. I won't give you any answer. Solve it yourself. Try and do what? Or set maybe when I'm doing the comparison for the CA. You can be. So that is why you should be in the class and record if you can. If you cannot, if I post the link, you go and do what? Listen to it. It will help you. All right. So we'll start from dosage calculations. We'll start from dosage calculation. Now, in pharmacy, this term or thing that has to do with drug medicine, this term dosage always do what? Occur. So you'll be hearing about the term dosage. So at least some of you here had an opportunity to work in other pharmacy or patent medicine shops or even hospitals, some of you, or maybe your parents are into such business. You must have been hearing dosage. So in your own understanding, what do you think is dosage? Who can help us? Any idea? Anytime you hear the word dosage, what comes to your mind? Please, this is the attendance. Please just sign, write your serial number here, full name, your surname should be in capital letter, then your reg number, then sign in, just sign in. Before I read the class, you do what? You sign again. Take my attendance seriously. If you write your name, you pass it on. So as The attendance is going. Let me hear you. Any idea? What comes to your mind? What are you going to say? Any idea? Okay, thank you. So, good. Quantity of drug dispensed. So if you come to my pharmacy now, I'll give you 5 packets of drug. Medicine is a dosage. Is that what they're telling us? Sit down. Any other? What's your name? Okay, success. What do you think?
Dosage is a frequency or ratio of drugs to be dispensed at a particular time.
The frequency to be dispensed at a particular time. I'm coming. What's your name?
Miracle.
Miracle who?
Is a miracle. Is a miracle.
Eze. Okay. What do you think dosage is? Or dose? Anyone?
It's the quantity of drug that should be taken at a particular time.
Okay. Sit down. What's your name? So what do you think?
Dosage is the quantity of drug. It's the quantity of drug that are dispensed. That are
Dispensed. What's your name? Okay.
Dosage is the amount of drug taken at a particular time.
Amount of drug taken at a particular time. Okay. What's your name? Chibike. Okay, so tell us.
Dosage can be defined as the amount of medicine to be taken at a particular time.
Okay. What's your name? Chibujeku. Chine. Okay.
Dosage is the amount of drugs
To be taken. Okay, so tell us. What's your name? Okay, Mary Cynthia. What do you think?
Dosage form is the
Not dosage form. That dosage and dosage form are not the same thing, no. Okay, continue.
dosage is the amount of drugs to be taken in a particular time.
Okay. Sit down.
Dosage is the amount of drugs required.
Required. Sit down. Anyway, you guys tried, but there's something missing. There's something that is what? Missing. Now, let me explain. When you say dosage or dose of a drug is nothing but is the amount of drug taken at a particular time. I agree, but something is lacking for a particular therapeutic purpose. Are we together? Yes. To achieve a particular therapeutic purpose. Yes. Maybe your therapeutic purpose what you want to achieve is you want to take care of your what? Headache. So let's assume if 500 milligrams of paracetamol taken, depending on the age anyway, taken, for example now, 3 times a day, particular time, frequency is also there, can take care of what? Headache. That means that is the dosage of the what? Paracetamol the patient need. Does it make sense? So you must add for a particular what? To achieve a therapeutic what? Or outcome. Very important. You must add it in the definition. It's not just the amount of drug. It's not just about the particular time or the frequency you want to take it. You also include a particular what? Therapeutic what? Outcome. Because that is the outcome you want that even made it to even go for the what? The medicine in the first place. Or that made the prescriber to prescribe the medicine what for you. Hope you know the difference between medicine and drug. Do you know the difference between medicine and drug? Who tell us? Adora, what's the difference between medicine and drug? Tell us.
What's the difference between medicine and drug? Tell us.
First, drug can be abused. The drug can be defined as chemical substances which, when taken,
who just hit, no long story, just hit the point. The difference between medicine and no long story, just hit it. See that? I want someone that will just hit it, the punch line. That's all. They just punch it. No long story. Difference between medicine and drug. At least it will help you know what if you know actually the difference. They're not the same thing, you know. So who can tell us the difference between medicine and drug? Just